Keeping plaque out of your arteries, well, it's not as easy as you think. I'm really tired of watching all different types of people on YouTube, so-called experts and things say, oh, just eat these foods and you'll be fine. Before we dive in, you're watching The Daily Dose with me. I'm Dr. Mitch. If you like our content, please subscribe to us and ring that bell so you're going to be notified when things are coming out. Just to give you the reason why I'm capable of speaking about this, I have 44 years of being a physician. I have written 4 textbooks, working on the 5th in integrative medicine. The textbooks were only written for the healthcare practitioners. I have not written for the lay public at this moment. And also, I have trained over 3,800 doctors in medicine of this nature. So I'm hoping that the information I bring you makes sense as opposed to just, oh, I looked this up or I used AI or whatever these folks are doing to, unfortunately, mislead people thinking that only one little thing makes a difference. But the truth is, every week when we bring you these different daily doses, my producer says, what do you want to talk about? Here are some things. And the truth is, a lot of these things are in the internet and YouTube and other places of that nature, but they're not really looking specifically at what should be done. And sometimes the advice is good and sometimes the advice is not. If you want to talk about keeping plaque out of your arteries, you need to first understand there is a one-cell lining that actually exists through your entire cardiovascular system. It is basically called the endothelial lining. It's the endothelium. It literally lines the entire 64,000 miles that basically makes you. It's a thin layer of specialized cells and the blood vessels and in the heart. Now you can understand if this one cell lining that God put there is not healthy, you are not going to be healthy. As a matter of fact, you will have heart disease, blood pressure, plaque, etc. So no matter what you eat, if you don't adjust this particular area, there will be a problem. This lining called the endothelial lining, yes, it is crucial for maintaining vascular health. Is it just me saying this? There's thousands of articles, but Harvard, everyone now agrees that endothelial lining makes all the sense. Why? What does it do, this lining? Well, first, it is a barrier, and it actually is a defense mechanism. It regulates the passage of material movement, like white blood cells, in and out of the bloodstream. Yeah, that's important. It also regulates blood flow. It's slick. It makes blood move smoothly. Actually, the blood leaving the heart usually comes back into the heart faster than it left. Think about that for a minute. Faster than it left, and there's no pump in your feet. But these cells release certain substances that control and relax the arteries, and they cause contraction. And they're one of the most important substances that you probably heard of and heard people talk about is nitric oxide. So if not enough nitric oxide is being produced, it's often because the endothelial lining's not working. It also produces anticoagulants, so you don't get blood clotting issues, and it stops adhesive molecules and inhibits this clot from occurring, because that's often what causes a problem. Not so much plaque, but blood clotting as well. And it does help to control inflammation. This endothelial lining helps the white blood cells stick to the vessel wall and go into tissues to fight infections. It also is the source of what we call angiogenesis. What's that? It's actually growth of blood vessels, new blood vessels, formation of blood vessels when the body needs extra blood or extra oxygen. And this, of course, can actually aid in wound healing as well. And it also deals with what we call blood vessel permeability. It allows the efficient exchange of gases and fluids and nutrients between the bloodstream and the tissues as well. Now, how do you test this? And we should do that in this segment, because now I think you realize how important this one cell lining is, because it's everything to whether you have heart disease or you have problems. And not that you eat 5 foods and, oh my gosh, it's all better. It's not happening. So don't take these things too lightly. There's something called nitric oxide testing. It's simple. It's a little paper that's a piece like a litmus test. You put it in your mouth, it will tell you if you have low, high, or proper amounts of this gas that is produced by this one cell lining when it's healthy. There is even something called autonomic nervous system testing. It's actually a test where they put a little clip on your finger and these sensors sensors that measure the change in what we call the pulse wave or the pulse width, which is an amplitude or the height in response to blood flow changes. So we can really get an idea whether that artery is working or not with two simple tests. There's others, but not as accurate, not as easy to do. And this is a little tiny thing that looks like basically a pulse oximeter that you've used to check your oxygen and see if your oxygen levels are appropriate or not. Okay, let me just summarize. If you want to really deal with the right way of knowing whether or not you're going to get any plaque or heart disease, you need to understand or keep your arteries clean. You need to have a complete understanding of the endothelial lining. Without it, whether it's a doctor or someone on the internet telling you, oh, it's just take this, eat this, you are in for a really big, not great surprise. So what I'm going to do, this is part 1 of 2. I'm going to bring you part 2 next time that will literally talk again about this endothelium, what you could do to prevent it from going bad, and if it already has problems, what you can do to exchange it. Yeah, I'll talk some foods and some easy things that you can do, but I'm going to put you on the right path. No more of this just, oh yeah, let's do this, let's do that, and we will get some real good answers. So stay tuned. Thank you so much for watching.